Hello, everyone, and welcome to another episode of Cellular Wisdom, where we peel back the layers of health myths and serve them up with a wink. I'm Ethan Foster, your resident observer of the human condition. I like to stare at it from various angles, then crack a joke. But who's counting?
And I'm Alara Sky, the sharp mind with an even sharper tongue. If you were expecting sympathy, you have come to the wrong place. Unless you want honest, witty insights about health that might actually help you, then maybe you're in the right place.
We're glad you've joined us for this conversation we're calling Dr. Mercola's Cellular Wisdom. Yes, Dr. Mercola, the man who turned the phrase natural health into an art form. The big news is that his newest book is now a bestseller, so apparently a few folks out there agree with him.
There's a rumor that every time he writes a new page, a major publisher spontaneously cries with joy. That could be a myth, though. You never know. But we're not here just for hype. Today, we'll highlight some of the most interesting points from Dr. Mercola's analysis on postural restoration, foot health, bunions, and random bits about LASIK and dental work. Doesn't that sound like a roller coaster?
Absolutely. A roller coaster with no seatbelt, right? Because who needs secure harnessing when we can do it barefoot on a tile floor?
Now let's jump in. According to Dr. Mercola, your body is naturally asymmetrical, and balance is all about how well your system handles these imbalances. When balanced integration fails, you get structural weaknesses and pain. That might explain why I keep tilting my head to the left every time I try to do yoga.
You do yoga? That's a mental image I'm storing for later. So apparently walking barefoot outdoors on uneven terrain is a dream. But walking barefoot on hard, flat surfaces like tile or concrete could be the reason that some folks develop bunions.
Bunions are not cute. They never made the list of body parts I'd like to highlight on social media. Yet I see a whole market of toe spacers, bunion braces, and foot contraptions. Now we know why. If you roam around your house for a decade with no shoes on tile floors, your feet might decide to contort themselves into creative shapes.
That's the elegant way to put it. Let's talk about that idea. The argument goes that humans used to stroll barefoot on beaches, grass, and uneven ground, which provided natural support. But if you live in a modern home with flat, uniform floors, you're forcing your arches to meet a surface that gives them no feedback. The foot arch tries to cry for help, but no one's listening. Then you wind up with structural changes.
Precisely. This also means we might need to rethink that barefoot is always best mantra. Dr. Mercola mentions how, despite being a big barefoot enthusiast, he ended up getting a bunion. He discovered that simply going barefoot might not be the right solution if your daily surfaces resemble a paved parking lot.
That's a bit like saying, I love living in Antarctica, but I dislike the constant cold. If you're going to do one, you have to accept the other. Except here, you do have a choice. You could pick shoes that provide the right kind of support.
Hence the entire concept of postural restoration. The Postural Restoration Institute, PRI, basically says, yes, you're asymmetrical. Your organs aren't symmetrical, your sides aren't symmetrical, and that's okay, up to a point. Once these imbalances get out of hand, you start having pain and dysfunction.
It sounds like we're walking works of art. Picasso might have loved this concept. The heart's on the left, the liver's on the right, so you must be a living, breathing piece of asymmetrical art.
He sure would. But in seriousness, this is important for everyone. The default assumption is that being symmetrical is normal. But in reality, the human body is designed with differences. The trouble starts when we can't compensate properly for those differences.
That's where footwear apparently enters the conversation. Footwear can assist your body in navigating these imbalances. Dr. Mercola cites Alina Kanner, who's a certified PRI practitioner. She emphasizes that, yes, minimalist shoes have been popular, but they don't necessarily help if you're basically living on tile or concrete.
Right. Minimalist or barefoot shoes get touted as the most natural approach, but the marketing misses the crucial part about context. Our ancestors on the savannah or in the forest weren't living on polished marble floors. They had uneven surfaces that gave the foot a chance to engage properly. You'd pronate, supinate, your foot would shift and adapt.
That means if you're determined to go barefoot, do it in the park or on the beach or anywhere nature is present, but maybe not in your apartment building's hallway or at the mall, especially if you're already noticing foot discomfort or these ominous bunion lumps forming.
Exactly. Kanner also points out that the right shoe has specific features, like a firm heel counter that can keep your heel in place, plus a decent arch so you get that feedback on your foot. It's like a mini cup for your heel and a gentle pillow for your arch. That steadies your body from the foundation upwards.
Dr. Mercola ended up with a Brooks Dyad extra wide shoe, right? That's not the sponsor of this show, but maybe we should call them up. He found that the wide toe box plus the right support helped manage the bunion.
If you're thinking, wait, how does that fix a bunion? It's not that the bunion dissolves instantly. It's that a properly structured shoe helps realign how your foot hits the ground. That, in turn, changes your gait, posture, and hopefully slows or reverses the bunion's progression.
Right? He also uses a toe spacer and a brace with a steel bar that pushes the toe outward. Good times. Let's not forget the comedic angle here. Nothing says fashion like a contraption that forcibly repositions your big toe. But if it works, it works.
You know, I've seen worse footwear. Some runway designs might compete with that. Anyway, the bigger story is that postural restoration is holistic. They look at your entire medical and structural history, dental work, eyeglasses, LASIK, root canals. All of that can alter your sensory input and how you move.
Let's talk about the teeth for a second. Kanner mentions that if you've had, say, a tooth extraction that wasn't replaced with an implant, your brain might lose track of how to balance your center of gravity. The body might tilt or shift to one side. That's because your bite is off, so your jaw alignment changes, and that cascades into your posture.
The next time someone says, that guy's off balance because he's missing a tooth, they might be onto something literal. I always thought it was more of a joke about intelligence, but apparently it's about gravity.
Our comedic disclaimers are short this episode, but indeed, posture and your teeth are intimately connected. When your jaw can't sense how to close properly, like if you're missing a molar, your neck might shift. You carry yourself differently. The chain reaction never stops.
That's one reason why people who've had multiple bouts with braces still find their teeth shifting. It's not just your teeth being rebellious. It's your entire body readjusting because you never gave your system the correct signals to know where center is.
So let's say you come in with mysterious chronic pain and you've seen every specialist with no relief. A PRI practitioner might say, could it be your missing tooth or your last 4 root canals that changed your bite? Or maybe your eyeglass prescription is too strong. They evaluate how that's affecting your stance and gait.
Dr. Mercola even changed his eyeglass prescription after a single session because once Kanner realigned his posture, his eyes literally saw the world differently. That is mind-blowing. Imagine walking out of an appointment and going, wow, I think I need new lenses. Usually you'd say that after you scratch them up. But in this scenario, your body's literally changed.
It reminds me of a carnival mirror effect. You stand differently, so you see differently. Let's not forget LASIK. Kanner warns that if you get LASIK, you might be permanently locking in a prescription that is actually not correct for your real center of gravity. Glasses, on the other hand, can be changed anytime.
That's a big revelation. If you think about it, LASIK basically reshapes your cornea. So if you do it while your posture is severely off, you risk freezing that off-balance lens prescription into your eyeballs forever. There's no, let's just tweak your frames scenario then.
I can imagine some folks are rethinking those laser ads that promise no glasses needed. Well, sure, but maybe you'll also be locked into an asymmetrical stance. Another example Kanner shared was a young woman in her 20s with knee pain, low back pain, fainting episodes, and all sorts of neurological symptoms. The root cause ended up partly being her visual prescription.
She was wearing glasses, but the glasses themselves might have reinforced an off-center posture. Once Kanner used her postural techniques plus an optometrist who gave her a prism to shift the center of mass, the patient's fainting episodes disappeared, the knee pain vanished, and she's back to running marathons. That's quite a transformation.
That's essentially the gist of postural restoration. You're dealing with the entire chain of neurological signals, from your eyes to your jaws to your feet, so that your body can find equilibrium in a way that relieves stress on joints and muscles.
Of course, this includes the dreaded CPAP machine conversation. Sleep apnea is on the rise, and the typical response is, here, strap this machine onto your face. But Kanner says that might be ignoring the underlying reason you're not getting enough air. Perhaps your posture is restricting your breathing, or your jaw alignment is messed up.
So the solution might be learning to breathe better, realigning your bite with a dental appliance, or getting your posture fixed so you don't compress your airway. Kanner even has a case of someone going from 55 apnea episodes an hour down to under 5 by using a dental appliance and mouth taping. That's a drastic difference.
For those who have no idea what mouth taping is, it's basically applying a mild, medical-grade tape across your lips before bed, so you're forced to breathe through your nose. As Kanner points out, you do want to be careful with kids. But if an adult is constantly mouth-breathing at night, it might help reduce snoring and improve oxygen intake.
By the way, just because you tape your mouth doesn't mean you can't yell at your spouse, although you might have to speak in muffled tones, so the comedic effect is priceless.
Honey, I would get you a glass of water, but my mouth is taped shut, sorry. Maybe it's a new excuse for ignoring someone's bedtime requests. Joking aside, mouth taping can shift your whole breathing pattern. It's no small thing.
All right, so how does one dig deeper into postural restoration? The Postural Restoration Institute has courses for all kinds of practitioners: dentists, optometrists, chiropractors, athletic trainers, physical therapists. They have a website, posturalrestoration.com.
Yes, but keep in mind it's a bit like learning a new language. Kanner says the courses are pretty in-depth, and you often have to take them more than once. You're retraining how you view the body, literally from head to toe.
And apparently there are only around 200 PRI certified practitioners in the US. So if you're near one of their hubs, Nebraska, certain places in New York, Texas, Seattle, and so on, you might have some luck.
Meanwhile, if you're a dentist or an optometrist who's listening and you have a rebellious streak, maybe you want to incorporate these principles into your practice. You might become part of a new wave. Then your patients will say, My dentist just told me my missing molar is messing with my posture. That might blow their minds in the best way possible.
Let's talk about a few more big themes from Dr. Mercola's conversation with Alina Canner. One is the notion that your footwear is a big deal, but it's not one size fits all. People have different patterns. One side might not be pronating properly, or your big toe might be drifting inwards, forming a bunion. So you have to figure out which part of your gait cycle is off.
Then you can use the right shoe with an arch or an insert, or even different support for your left foot versus your right foot. That specificity is what we're missing from the usual approach of wear these trendy minimalist shoes so you can be just like your caveman ancestors.
And don't forget, your ancestors didn't have tile bathrooms or grocery store aisles with unyielding concrete. If they walked on stones, those stones were not laid perfectly flat in a row. They were scattered, creating that needed variety for the foot arch.
Then there's the issue of braces and orthodontics. Repeated braces might indicate your teeth are desperately trying to find center because your body is off. Canner suggests that if you have a complicated dental history or repeated shifting in your teeth, you might want a second opinion from a postural standpoint.
And if you're a runner who's chronically in pain, or you have a persistent lower backache that nothing else solves, it might be something as simple as your foot posture or your bite. The body is one big puzzle, and we keep forgetting that the piece labeled foot is connected to the piece labeled jaw.
Or to the piece labeled eyeball, for that matter. My personal favorite is the LASIK caution. It's such a go-to procedure, but Canner reminds us that a permanently etched prescription might lock you into a poor posture. If you suspect you might not be symmetrical, you could see a PRI provider first before going under the laser.
That's a bigger conversation about short-term fixes versus a more nuanced approach, because you might see a slight improvement in your daily life if you get LASIK, but you might also cause an imbalance that you don't realize until you can't figure out why your neck hurts when you read a book for 20 minutes.
Meanwhile, Dr. Mercola is a living example of how an open mind and an arch support can do wonders. He says that his bunion wasn't painful, but it was a deformity he didn't want to get worse. He started investigating the root cause. Now he's teaching the rest of us to do the same. Maybe that's how you sell 1 million books.
The comedic highlight is that if you're at a party and you see someone wearing wide-toe box shoes and popping a balloon, apparently Canner uses balloons in her techniques. Don't be alarmed. They might just be doing some advanced reprogramming of their posture.
I love the image. Hold this balloon, twist your body in a funky posture, and blow. It's definitely not your typical workout move. But Canner says that these balloon exercises force you into positions that compress one side of the body and expand the other. It's about reversing your usual pattern.
She also uses a kazoo sometimes, right? That alone is comedic. She's basically orchestrating a one-person band for your posture. But apparently it works because it's retraining how you breathe and how your brain interprets that breathing.
Don't worry, nobody's going to say, go buy a kazoo or else you'll have bunions forever. But it's part of a larger set of creative exercises. The bigger point is that your breath, your feet, your eyes, and your jaw all need to be on the same team.
Let's shift gears to the mouth taping and CPAP phenomenon because that's another major highlight. Sleep apnea is sometimes posture-related or jaw-related. We keep looking at it as though we just spontaneously stop breathing at night because our bodies are bored. But if you address the underlying mechanical issues, you can drastically reduce the episodes.
Just imagine going from 55 episodes an hour to 5, which is considered normal. That's an astonishing improvement. It's basically giving the body permission to do what it's meant to do. You just have to guide it properly.
The message to me is that we are built to adapt, but sometimes we adapt incorrectly because modern life is, ironically, unnatural. And that's when you might need a little extra guidance from these specialized forms of therapy.
Absolutely. Another gem from Canner's approach. She sometimes has her patients work out with a dental appliance in, or even sleep with it. That might sound weird, but if your bite is properly aligned in that moment, your body can learn that better pattern, and eventually you won't need the device. The same with the prism glasses for that 20.
These are also fluid solutions, not permanent. You might wear glasses or use a dental appliance for 6 months, and then you no longer need them because your body has recentered. That's a powerful concept, that we can still change as adults.
The corollary is that we can also do damage as adults if we keep walking barefoot on tile floors with minimal arch support. I know a few people who will be rummaging through their shoe closet after this conversation. Maybe it's time to retire those ultra-minimal trainers.
One last highlight. If you're a health professional looking for more, the Postural Restoration Institute offers 3 main courses that you usually retake to fully grasp. There's also a separate vision course, plus a dental course. The idea is to create a network of professionals who understand how to check for these postural imbalances.
So it's a big deal. PRI is not just another therapy acronym to memorize. It's a fundamental shift in how we view the body. As Canner said, it draws from osteopathic medicine, craniosacral concepts, dentistry, optometry, a big melting pot.
Indeed. Let's do a little summary. 1. Humans are asymmetrical, so embrace that fact. 2. For those who jump on the barefoot bandwagon, consider the surfaces you stand on. If it's mostly tile or concrete, You might be setting yourself up for issues like bunions. 3. We can realign ourselves using the right shoes, arch supports, or specialized braces.
4. Your bite, vision, and breathing can all affect posture. If you're missing a tooth or have an old pair of glasses, that might be the reason for nagging back or neck pain. 5. LASIK can lock your eyes into an incorrect posture if you do it prematurely, so investigate your body alignment before you sign up for the procedure.
6. Mouth taping might help with snoring or sleep apnea by forcing nose breathing. 7. CPAP isn't always the final answer to sleep apnea. Sometimes the cause is mechanical alignment. Finally, 8. Postural restoration is a comprehensive approach that sees the body as an interdependent system.
Did you make a neat bullet list in your mind? Because that was quite organized for a comedic moment. I'm impressed.
I'm practicing for the day I run my own comedic health clinic. Come for the jokes, stay for the posture tips.
Sign me up. So, to everyone listening, we hope you learned something. Maybe you'll investigate a postural restoration provider near you, or just reconsider your choice of footwear. Or you'll look at that missing tooth with new suspicion.
And that is Dr. Mercola's cellular wisdom for today. As you can see, it's not just about cells, but also about how each cell depends on structural alignment. If you liked what we said, blame Dr. Mercola and Alina Canner. If you didn't, you can blame me for reading the notes incorrectly.
Right. And if you're looking for more details, Dr. Mercola has posted about this extensively, including a thorough interview with Alina Canner. But for now, we'll let you regroup as you realize your mismatched socks pale in comparison to your mismatched posture.
Before we go, I'll just mention that Dr. Mercola's new book is out, and apparently it's flying off shelves. As always, the man's got a knack for stirring up conversation. Maybe it's that knowledge that the mainstream hasn't fully embraced. Or maybe it's because we all love a good health tip that doesn't require chemical additives.
Let's sign off with the official tagline, Cellular Wisdom, where we dissect health myths with a scalpel and a smile. Actually, let's rewrite it for today, where we dissect your posture with a shoe, a balloon, and a laugh. Doesn't that sound enchanting?
Very enchanting. Thank you, listeners, for joining us. I'm Ethan Foster, here to remind you that the difference between comedic commentary and actual posture realignment is probably about 6 months of therapy plus a prescription from an optometrist.
And I'm Alara Sky, telling you that if you're still trying to fix your bunions by ignoring them, well, ignorance is not always bliss, especially if your feet are morphing into geometric shapes. Go forth, do your research, and maybe get a kazoo just for fun.
Thanks for listening, everyone. Until next time, keep your laughter sharp and your arches supported.
And remember, you're asymmetrical, but that's no excuse not to strive for balance, especially if it keeps you upright and bunion-free. Farewell, dear listeners. May your toes forever wiggle in comfort.
Goodbye, folks. Stay balanced in more ways than one.